I grew up in Milwaukee, Oregon, so it's fun to say that I grew up in a city where Milwaukee is spelled K-I-E, and now I'm settled in the other Milwaukee, spelled K-E-E. I attended an all-girls high school called St. Mary's Academy in Portland that truly supported young women. And I think these years provided an important foundation for me to see the opportunities for women's leadership and to help give me confidence in identifying and following my passions. In high school, a mentor suggested that child psychology would be a good fit for me. So I kept that in mind as I took a gap year and then began college afterwards. For that gap year, I studied in Germany just as it was reunifying, and so it was an exciting time to be in Europe. When I returned to the United States, I attended Stanford University. And after an introductory course in psychology, I decided that that's what I wanted to study. So I majored in psychology with a minor in children and society. As an undergraduate, for 3 years, I worked as a psychology research assistant. I also completed a senior honors project and fell in love with psychology research. My experience doing my senior honors project really helped inspire my vision for the honors in psychology program at Marquette, which we've had in place now for several years. After graduating undergraduate, I decided to attend graduate school at Case Western Reserve University in Cleveland, Ohio, where I earned my doctorate in clinical and child psychology. After living in Denver, Colorado for 4 years to complete my predoctoral and postdoctoral training, I accepted a job at Marquette, and I will be starting my 18th year at Marquette this fall. I teach both graduate and undergraduate classes. For undergraduates, I teach health psychology and honors research methods. For next spring, I'm developing a course called Psychology of Gender and Health, which I'm very excited about. At the graduate level, I teach a class on professional ethics. This fall, I'm also going to begin as director of the Family Studies minor. An important aspect of my identity is that I'm Latvian American. My parents emigrated to the United States when they were young adolescents. Latvia is a small country about the size of West Virginia that's east of Sweden by the Baltic Sea. Latvia was occupied by the Soviet Union until 1991 when it regained independence. I grew up very involved in the Latvian community, and I met my husband through the Latvian community. At home, we speak Latvian, so our children are also fluent and active in the Latvian community. One of my favorite activities is Latvian folk dancing. As I'll share in a little bit, in recent years, I've been able to merge my Latvian heritage and research interests. I have 3 areas of research interest that overlap, but are also quite unique in the questions are explored. The first area is looking at children's and families' adjustment to illness. So specifically, I'm interested in how children and families manage when a child is diagnosed with a chronic illness. For these projects, I work with colleagues at hospitals and medical centers like Children's Wisconsin. For an ongoing study, we're looking at the experiences of adolescents with type 1 diabetes who also have symptoms of depression. We're interested in the medical and mental health care that they've received and are hoping that our research will provide recommendations for improving their care. A second area of interest is looking at socio-emotional development processes and factors that support that development. Research in this area looks at how children experience, express, and manage their emotions and how they establish relationships with other people. For the last 8 years, I've been working with 2 local charter schools to support teachers in using mindfulness in the classroom, with the goal of helping children develop skills to better regulate their emotions and behavior. So I've been studying how teachers implement a mindfulness curriculum in 4- and 5-year-old kindergarten classrooms and whether they regularly practice mindfulness activities and whether this practice has an impact on children's attention and ability to regulate their behavior. A third area of research is looking at factors that promote and challenge girls' and women's well-being. This is an area of research that I've been developing in the past 3 years that's been very exciting. I've been collaborating with an organization in Riga, Latvia called Marta Center. This is a nonprofit that aims to support women in Latvia, including women who are not citizens and migrants, women from low-income backgrounds, and female victims of human trafficking and of domestic violence. In work that spanned 2 years, we examined the perspectives and experiences of Latvian adolescents who participated in MARTA Center youth programs. During the past 15 months, I've been a collaborator on 2 projects to better understand women's experiences during the COVID-19 pandemic. We conducted one study last spring, and in recent weeks, we've been collecting data about women's experiences later in the pandemic. A common theme across all 3 areas of research is seeking to understand what kind of skills and resources may help or make it more difficult when individuals are faced with various challenges. My approach to research represents an integration of child development, pediatric psychology, and developmental psychology perspectives. I use a range of different research methodologies, including observations, interviews, and asking individuals to self-report about their thoughts and behaviors. In all of this, I hope to better understand the complexity in the interactions between individuals, families, and the environment, and how they may impact children, youth, and their families. I also love collaborating with colleagues and working with teams when conducting research. In medical settings, this involves including individuals from different professional backgrounds. And when doing community-based research, I value partnerships with organizations. Developing truly collaborative relationships is what makes the research I do possible, and I'm very thankful for those many partnerships. I quickly get excited about possible research questions and projects, which is why I've developed several areas of research, and I have even more projects that I didn't describe. Beginning with the collaboration with MARTA Center and continuing through the recent pandemic-related research, I've been eager to gather information about girls' and women's experiences in different circumstances. One of the goals of MARTA Center youth programming is to provide opportunities for adolescents to explore their beliefs about gender roles, violence in relationships, and what constitutes healthy relationships. There's very little information about Latvian adolescents' beliefs about these topics and what kind of prevention and intervention efforts may be most effective to change beliefs. Since I'm fluent in speaking, reading, and writing in Latvian, I could travel to Latvia to collect data. I'm thankful for the support I got from Marquette's Office of International Education, which made my first trip to Latvia in February of 2019 possible. The Office of Research and Innovation helped fund my second trip in November of 2019 to present our initial findings and gather more data. The opportunity to conduct this research and then share the results to Latvian professional audiences was truly amazing. In the 30 years since Latvia declared independence from the Soviet Union, there's a paradox of images of strong and independent women and equal legal rights for men and women, but gender stereotypes and sexism continue to be perpetuated. So compared to other EU countries, women in Latvia often suffer more from the consequences of physical violence. Since research documenting relationships between sexism and interpersonal violence, there are many possible avenues for intervention as we seek to better understand what adolescents believe. These are topics that are very important to discuss in Latvia. So I think helping MARTA Center document their prevention efforts is very important. We know that changing societal beliefs is extremely challenging, but working with youth provides us an opportunity and hope for change in the future. So last April, during the early months of the pandemic, together with my colleague Deb Oswald, we designed a study to understand American adults' experiences during the pandemic. We were reading stories in the media with information from polls, and we heard anecdotal reports of women's experiences, but we really wanted empirical data to better understand what people were experiencing. So during May and June, we collected data using an online survey from almost 1,000 adults, of which more than 500 were parents. We advertised the study to the Marquette community, so we had local representation in our data. We've now written 2 papers from that data set, one describing parents' pandemic experiences and one describing women's experiences with intimate partner violence. Our colleague Lindsay Hawley also contributed to the paper about parents' experiences. We had several interesting results when considering gender in analyses among the participants who were parents. Being female predicted higher rates of feeling overwhelmed in one's parenting role, and mothers appeared to be doing the majority of household labor tasks. Although this may not be surprising, it's still important to document that this was occurring during the pandemic. In analyses with just women, we found much higher rates of interpersonal violence than pre-pandemic levels that have been supported in the research. And one of the risk factors for experiencing interpersonal violence was having a child under the age of 18. As the pandemic continued, we reflected on these results and decided to investigate in more depth the support of the experiences of working mothers. So we've spent several months designing the study and appreciate the support we received from the Institute for Women's Leadership to conduct this next study. We've been collecting data using an online survey format and aim to have results from 250 working mothers. We're asking questions about a lot of different aspects of women's experiences during the pandemic. We'd like to know about their COVID-related experiences and the impacts that those have had on their lives. We're interested in women's employment experiences and their work-life balance. We are asking questions specific to parenting. So we want to know more about their parenting behavior, their experiences of feeling overloaded and burdened out by parenting responsibilities. We're also interested in children's experiences, what their education situation has been during the pandemic, how they're dealing with stress and changes due to the pandemic. We're interested in mothers' well-being. So what are their levels of stress, depression, and anxiety, and also how they're coping. So what are strategies that they're using that are helpful, and what are their resources for social support? We think that the findings from our original study and findings from the second study are important for recommending the type of direct services and public policy changes that are needed to be in place to support women and families. Supporting parents is important because we know that parent mental well-being has implications for well-being of other family members, as well as family functioning overall. And we know that the current pandemic may have long-lasting mental health consequences for both children and parents. And so we want to know what to expect and what those experiences are. The findings from our studies may also inform the development of policies and programs to assist parents with unique difficulties faced by the pandemic, but also in similar circumstances. So we hope that policy changes may include supporting more equitable distribution of care work between men and women and supporting working parents. It's necessary to support parental paid leave, childcare, and employment flexibility. We know that many parents have struggled and continue to struggle during the pandemic, and this research from these studies can provide us information about what programs may be helpful to have in place in the future.